Hello, everyone. This is Dr. David Pascal talking to you from the Pascal Health Institute in gorgeous Cary, North Carolina. We have a beautiful spring day, and I would like to take this opportunity to first thank you all for being here, whether you're watching live or you're watching recorded. And second, to tell you what we're going to talk about, which is our autonomic nervous system and the role that that plays in complex regional pain syndrome. And we'll just make sure we've handled all these technical things with the camera. So, welcome to be here. Our nervous system can be divided up into a lot of different ways, and one of those is in terms of what we have active control over, right? So I can move my hand, actively do that. I'm consciously sending signals to my muscles and purposefully doing that. And then we have another part of our nervous system, which is on automatic, which we don't have to think about. It's just set, it runs in the background. MDs like to use fancy words, so instead of just saying, hey, it's the automatic part of your nervous system, they call it autonomic, the autonomic nervous system. There are a lot of different words for systems and body parts that are just changed a little bit to, I don't know, it seems to me to put some barrier or some height on the Western, medical doctor versus the lowly ignorant patient. Kind of bugs the heck out of me. That's just a little personal aside. But our autonomic nervous system, that's a part that we don't have direct control over. It runs in the background, and we have primarily two parts to that, which is our sympathetic nervous system, which is go, 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 fight or flight, and our parasympathetic nervous system, which is rest and digest. Both of these play a vital role in people with CRPS, with complex regional pain syndrome. Some examples of our autonomic nervous system is breathing, right? We don't have to think about that, although we can override it. Heart rate, again, we don't have to think about it, but we can override it. Our blood pressure, our healing rate of our cells, our digestion, all of these things are running in the background, but they do have a major impact on people with CRPS. When we do talk about sympathetic, that's go, 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 that's fight or flight, that's fear, that is kind of the state, the go, go, go part that we need to be more in when we're awake during the day. And then the parasympathetic is rest, digest, heal. That is where we primarily shift into when we are at sleep. The analogy that I most like to use is if you think of your body as a factory, that during the day, that's when all the workers are at the factory, all the machines are going, and everything's like, go, 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 we got to make these products, whatever those products are. That is not the best time to be doing repair work on the machines or cleanup, right, in the factory. So during the day, all the workers are at the factory, that's sympathetic, we're going, we're producing, we're making whatever we need to. And during this time, our repair crew is home, sleeping, resting, getting ready to come to work. Then at the end of the day, all the workers, put the machines down into an idling state and they all go home. And then the repair crew shows up and now they start repairing all of the machinery, doing all the cleanup. That is the parasympathetic. It creates a big mess when you try to do both. It's like trying to, in a lot of ways, it's impossible to do. Like you cannot be driving down the street in your car and changing your car tire at the same time. You actually have to pull over to the side of the road, stop, jack the car up, take the tire off, put the new tire on, lower the jack, and now you can go again. Very hard to be in the sympathetic anxiety, fear, go, 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 doing 10,000 things and also properly heal, which is a big part of our program here. When our patients with CRPS come, we bring them in the morning, they're in the office, hour and a half, 2 hours, we're doing all of these things that are trying to push the body into a parasympathetic healing state, then it's very important that everyone goes home for a few hours, back to their Airbnb, back to their apartment, back to their hotel, whatever the situation is, and rest. Actually let your body move into that parasympathetic state from the things that we did in the office that morning. Then come back in the afternoon. Now let's, rev the body up a bit more, do whatever neurologic work, immunologic work we're going to do, then start moving that body back out of a sympathetic state into a parasympathetic state. Again, in the office for an hour and a half, 2 hours, go back home and allow your body to shift into parasympathetic so that you can heal. Our patients that are always trying to go, go, go all the time, especially in between the morning and afternoon treatments, they don't make the same progress that people that come and listen to what we're talking about and allow themselves to go back home and rest. I understand it can be frustrating because you've already had this problem for a very long time and you want to get better. And when you start to feel better, you want to do more. But it's much more efficient in the long run to allow your body to move into a parasympathetic state and heal. So, what are some of the signs of an autonomic nervous system that is not functioning normally, that is dysregulated? We even use a term like dysregulation or dysautonomia. Dys means not, right? So if you're not in a normal autonomic nervous system response, and we call it dysautonomia. One of the most common things we see with CRPS patients is POTS, right? Positional orthostatic tachycardia syndrome. These are people that when they go from laying to sitting or sitting to standing, they get dizzy, they get tachycardia, they have vertigo, and then the all the anxiety that comes with that. So what happens there? Well, the brain needs a certain amount of blood to bring oxygen into the brain and keep the brain tissue alive and healthy. When we are laying down, the heart is pumping blood, but it's not pumping it against gravity. So we have these pressure receptors in our arteries that are monitoring how much blood pressure there is in the overall system, how much blood pressure there is in the brain, how much blood is in the brain. And so when we're laying down, it's going to kind of keep those arteries kind of open, right? When we stand up, now we've got to pump blood against gravity. And so the arteries are going to contract. There's a muscle wall to arteries. Those arterial walls contract, make the diameter of the blood vessels smaller, and that helps push the blood up into the brain so that we still get, even though we're standing now and we're fighting gravity, the brain is still getting the oxygen that it needs. Well, if those receptors, those pressure receptors, baroreceptors, are not functioning normally or hypersensitive or too insensitive, then our brain isn't going to get the blood that we should get. That's going to trigger dizziness. That is going to even directly just from that change our heart rate. But our heart also has its own regulatory receptors to monitor heart rate. So that can be off, and now the heart can go into a tachycardic. Tachy means fast, cardiac heart, fast heart. Again, another example of using a combination of English and Latin to describe a symptom that can lead to some confusion and in the patient, and that separation again between the doctor and the patient. But tachycardia, basically your heart's beating fast. I used to have tachycardia back when I was a teenager, very common for a lot of kids when they're growing to go through a phase of that. And my resting heart was very low, heart rate was very low. I used to be a runner. So as a teenager, I was down in the low 40s, upper 30s. It got even lower than that in my 20s. but I would have episodes where my heartbeat would go up to 220 beats, even 230 beats per minute. That's quite a range from 40 beats a minute to 230 beats a minute. And so then I got all sorts of symptoms. All of that is regulated by my autonomic nervous system, but my autonomic nervous system was not regulating things correctly, and that created some problems. With CRPS, one of the hallmark issues that we find is this dysautonomia, is this autonomic nervous system that is not functioning like it should. So that means our food doesn't get digested like it should. That means we don't have normal blood flow to our extremities. A lot of people with CRPS are going to have swelling, right? That's part of under the control of the autonomic nervous system. They're going to have skin discoloration. People can turn blue or purple or red or white, all from this dysregulation of our autonomic nervous system. We can have, of course, injuries that heal much slower because of autonomic nervous system dysregulation. And a big part of CRPS is we have our original injury site. So there's all of those soft tissues or bone, but then we also have the nerves as well. And like in type 2 CRPS, where we have frank nerve damage, um, frank meaning obvious, another medical term in there, sorry, uh, specific injury to the nerve, and now the nerve itself is damaged and it needs to be repaired, and nerves heal very, very slowly. So when patients come into us, a lot of our neurologic testing is of the autonomic nervous system, figuring out where all the deficits are, and then we are doing different treatment modalities and neuroreflex techniques to help restore normal autonomic nervous system function. And one last thing before I let you go today is one of the gold standards, or probably the gold standard to assess autonomic nervous system function, is with a machine called heart rate variability. You've probably heard of that. It was first laid out and described in the 1950s, and now with things like the Oura Ring and Apple Watches and all sorts of tech devices like that, it is really in the common vernacular of our society. HRV, what's your HRV? But this all came out of studies in the 1950s, and then the Russians did a lot in the 80s and 90s. Their original purpose was to try to identify elite athletes in children, and they thought that HRV might be a good way to do that. I've been using heart rate variability studies in my office for over 25 years, and what it assesses is your sympathetic nervous system, how well that is functioning, and your parasympathetic nervous system, how well that is functioning, and the interplay between the two. So anyone that comes into our office is definitely going to get an HRV evaluation, and then we're going to go from there. So I hope you found this information helpful. If you have any questions, you can comment below. You can always reach us by commenting below, or texting our office, or emailing our office, or calling our office. My office phone number is 919-380-8000. Our email is drpascalhelps@gmail.com. Feel free to ask any questions. I just want to remind you that we do have our own private Facebook group, CRPS Solutions, where we have, 500 or so members on there, where you can post and ask questions. And then on my on my YouTube channel, which is Dr. Dave Pascal, are about 30 or 40 little videos where we talk about all sorts of different various things related to CRPS. So I wish you all a blessed, healthy, and happy day, and I look forward to talking to all of you in the near future. Goodbye.